Hi, everybody. We're really excited to bring to market something that major employers who are self-insured, they cover about 55 million employees across the US. And they care very deeply about this because they know from their book of business that there are 128,000 deaths every year from adverse drug reactions to drugs that people are properly taking. We're not talking about abuse or inappropriate usage, but FDA approved drugs taken as prescribed, but because of our genetics, we don't respond normally. So 128,000 people die from it every year in the US alone. That's more people than die of breast cancer. In addition to that, 2.7 million inpatient admissions, which are very expensive, and failure rates. 90% of drugs don't work for 30% of people that are taking them or more. The cost of adverse events are significantly high. When employers or insurance companies look at what they call their outlier claims, their biggest claims, several hundred thousand, 500,000 adverse drug events are a major player. The cost of drug failures as well. Many chemos only work for 50% of the people. Behavioral health drugs are notorious for under 50%. Type 2 diabetes, 43%. These drug failures leave people untreated and lead to more complex chronic conditions that cost a lot of money. So overall, billions are wasted and outcomes are poor. Now, almost everyone has a genetic variant that'll impact a drug. Personally, I have 15 variants and it impacts 84 drugs. Other people have a different number, and depending on your variant, it can impact a lot more. We have people in our database that are impacted 240 drugs. And once you take more than one drug, your risk goes up. 18% of all people who are on 2 or more drugs have already had an adverse effect. When you add a 5th drug, it over doubles your risk of a serious adverse effect. As you can see, drug failures are a critical program. Major insurance companies and employers spend a lot of money on disease management, chronic management, mental health improvement programs, and they focus on compliance, making sure people are taking their drugs. Well, if you're taking a drug, but it doesn't work for you, compliance doesn't matter. So they care very deeply that you get on the right drug. So what we do is we do a simple genetic test. It's a cheek swab, you order it online. Employers pay for it, but 100% of the cost for people who are in one of those chronic disease management programs or on several drugs, or if they're on one of the 25 most dangerous drugs. They send the swab back and talk to one of our specially trained doctors who understands pharmacogenetics. And then they can use their phone anytime that they're in the doctor's office or the drugstore, whether it's for a prescription drug, an over-counter the drug. They type in the first 3 letters and it instantly tells them, they click on the proper spelling of the drug because nobody knows how to spell it, and it instantly tells them whether or not they're going to respond normally, if it's going to work. If it is, it'll be in their green zone. If it's not in their green zone, if it's in their yellow zone, that means that it could still work for them, but not at the normal dose. Maybe they need half the dose to be safe. Maybe they need double the dose to be effective. In the red zone, it means doesn't matter what the dose is, it's not going to help you, or because of your genetics, it's too high a risk. You're one of the people that are going to have a serious response, a thrombosis, for example. This is all very predictable, so it's important to know ahead of time. We give the people that information so that at the counter, they can make a decision. Because this is something that saves a lot of money and improves care, revenue and EBITDA is very good, as you see from our projections. And our team is made up of people who understand genetic science, understand data, and physicians. And it's been really helpful to us for these physicians to share their experiences with their patients who have had adverse reactions to a drug they didn't prescribe, but to a drug they didn't know anything about because it's not in their area of specialty. So they've been really helpful in helping us make sure that what we do helps doctors do a better job. And we hope that investors will want to get on board. Thank you.